In 2015, I finished this online year-long coaching with the Institute for Psychology of Eating. It taught me a lot about food addiction and emotional eating, so I decided to do another video on food addiction, but this time talking about the emotional component of it. So this was my comment on Pim's video on addiction. It is very good to watch a video of Gabor Mate and how he explains addiction, gives you some idea.
Well, it's in everything that I write. I try to look at connections and the overall picture rather than isolating the problem and seeing it as a distinct entity. And addiction is not a problem in itself. It expresses something about people's lives and the nature of the society that we live in, and also about how we develop in a particular environment. So I'm interested in that larger picture, which is what makes my work a little bit different. For one thing, when you actually work with people daily, addiction takes on a human face. And when you talk to people about their lives, you get that addiction is the end point of a long process suffused by suffering from early childhood on. And for another, if you're open to yourself, you get to see that you're not that different. I'm not that different from the people that I work with. I'm more fortunate in a lot of ways, but there's a lot of fundamental dynamics that I can recognize and resonate with. So really, it takes away the otherness of the addict. Well, my definition of addiction is any behavior that has negative consequences, but a person continues to crave it and relapse into it, despite those negative consequences. And if you look at it from that point of view, there are many addictive behaviors in our culture. If you look at it from the point of view of brain physiology, which we can get into, the shopaholic and the workaholic, they're trying to excite and release the same brain chemicals that the drug addict is after. So both from the point of view of behavior and psychological dynamics and brain biology, there's only one addiction process. At the extreme end of that scale is the substance user who's injecting heroin and cocaine. But 30% of adults in Canada between 19 and 64 years of age define themselves as workaholics, which is to say they feel listless and unhappy when they're not working, and they ignore their families for the sake of the kick, the adrenaline and dopamine kick they get out of work. There's that compulsion to get something right away. So I'll drop everything and I'll run down to the store and I have to have this particular disk right now. So I ignore somebody who's in labor and a patient of mine. I'll go down to the store to buy a disc. I'll spend $8,000 in a week. I did once, not because I made a conscious choice to do so, but because I was compelled to keep going back and going back, thinking that just one more will do it for me. Let me just say that if I look at the negative impact, the negative impact is that I lie to my wife. In other words, I undermine a relationship with my spouse because addiction almost automatically brings shame. And I'll ignore my kids.
The root cause and the consequences, while perhaps not as deleterious, are directionally the same.
Absolutely. And it's, for the family, I mean, what does a kid feel like when his father is with him, but he's actually just thinking about his next purchase?
We often hear about an addiction gene, the notion that addicts are born, not made. You reject this.
Well, there's simply no science behind it, or at least the science behind it is laughably illogical. And the assumptions that it's based on is that genes determine things. But first of all, nobody's ever identified a specific addiction gene for anything. Although there might be some genetic predispositions for certain traits that can lead to addiction, for the most part, genes are turned on and off by the environment. If I planted a seed of wheat on this table here, it wouldn't grow. There's nothing here that would turn on those genes to make that plant thrive. It's the same with human beings. And so most of brain development occurs under the impact of the environment, beginning in uterus. If you stress animals or human mothers during pregnancy, their offspring will be more likely to have addictive behaviors as adults. Not to mention the well-known fact that most substance abusers were themselves abused as children.
Well, this is a big thesis, or part of the thesis of virtually everything I think you've written, is that early childhood development is incredibly important, period. And in this instance, what goes on in early childhood can make you more prone to addiction. Explain that.
Well, there was a study in California that looked at 17,000 adults half of whom had been to college, 30% of whom had completed college. In that population, they looked at what they called adverse childhood experiences, ACEs they called them, such as abuse in the family, a child being hit or sexually abused, a parent being hit by another parent, addiction in the family. If a child had 6 of those adverse childhood experiences, his chance of becoming a substance user was 4,600% greater than that of a child who did not have those experiences in childhood. Because what happens is that the early experience actually shapes the brain.
Neurologically, the brains develop in a different way based on the behavioral context.
So it is a very well-known fact that trauma changes the brain. And this can be any type of trauma. Brain and body will change. Especially somatic experience or the sensory motor psychotherapy developed by Pat Ogden work mainly with the body. That's a bottom-up approach because trauma is stored in the body.
Have you ever felt that words weren't enough to help someone heal? In some cases, just talking could even re-traumatize. To help us understand this roadblock, we will be interviewing Dr. Pat Ogden. We will discuss why words aren't enough to help certain patients, and the importance of integrating body awareness and even touch when treating those who have experienced trauma.
When we talk about talk therapy, it's kind of a top-down approach where we're working with cognitions, for example, of trying to reframe the present moment as being safe and not dangerous, and hope that that will have a trickle-down effect in the brain to calm the limbic and the reptilian brain, and also in the person's, psyche, so that they feel safe. But the bottom-up approach, which is what sensory motor psychotherapy integrates bottom-up with top-down, we work with the body directly to affect the lower levels of the brain and then track how that changes the thought process.
And we're not just discussing the concepts of sensory motor psychotherapy. We get into the meat of the matter and address how practitioners can apply this technique to help a variety of patients, including people who don't fit the typical profile of a trauma victim. These treatment approaches have valuable applications in doctors' offices and hospital rooms. They can be used for a patient who's just undergone surgery or received a diagnosis for a catastrophic illness, such as cancer.
Well, one of the main things is to take time with the patient and kind of track the patient to see if they're engaging with you and try to get their participation with you. Because if they start to get immobilized or go into a panic, that's going to re-stimulate the whole trauma-related circuitry in the brain. So one is to stimulate their engagement with you, and two is to help them take assertive action, help them be in control, and offer suggestions to them for how they can be in control. There is research that shows that if you can take action, if you can do something positive in your own behalf, there's much less chance of being traumatized.
This is what normally happens. You go into fight, flee, or freeze. That's how we used to run away from a tiger or a mountain lion. Or fight some intruder. Or sometimes it can be life-saving if you freeze and don't move. But if the body is stuck in a permanent position of fight, flee, or freeze, then this will cause issues, of course. You see how a healthy nervous system looks like in comparison to a nervous system that is stuck on a fight, flight, or freeze response. And then we will react to stressful situations in this way. We will either fight, flight, or freeze. Every single time, even if it's not necessary. And the brain is in constant survival mode. And prefrontal cortex is offline.
Absolutely. The structures of the brain, the chemicals in the brain, the transmitters in the brain, the circuits are all defined and shaped by the environment. If you do a scan of women who are depressed and were sexually abused as kids, and you look at the scan of women who are depressed but they weren't sexually abused, there's a difference based on the fact that these women were sexually abused. In other words, early experiences. And I don't have a single patient, by the way, in the downtown east side, a single female patient who was not sexually abused as a child. Not one, not even by accident have I met one. And that's completely in line with the statistics. So early experiences powerfully shape the brain, plus they create the lifelong emotional pain that the drug then comes along to soothe. So from my point of view, the question is not why the addiction, but why the pain.
Seems that given that notion, then using drugs is self-medication.
Which is what it is. So many people will tell me that I use crystal meth or I use cocaine, it calms me down. You know what they're telling me? They're telling me they have an attention deficit hyperactivity disorder, because taking a stimulant will calm that person down. So people are medicating ADHD. People are self-medicating depression with their drugs.
Well, now this is where it gets really controversial, because that says that it's really not a matter of choice, then, is it? It's survival.
It's not a whole lot of choice. You know, the problem in drug addiction is not the free will, but the free won't. Their brains cannot say no, because the circuitry is so empty and so full of craving for that release and that soothing and that diminishing of stress, that when that child, and usually addiction starts in teenagehood, that child does drug for the first time, they feel calm and together like they've never had in their whole life. And in that moment, they're hooked. And that's a susceptible person.
So then, research that's fascinating in this book is what happens to the addicted brain. This is after the fact. Talk to me about that.
Sure. Well, chronic alcohol use, or chronic cocaine or heroin use, it'll stop brain development, which will further diminish the power of choice, of course. So now a damaged brain has to make a choice to heal. This is the dilemma that we're facing here. And so if you look at the gray matter or the white matter in the brains of chronic users, you'll see characteristic changes and failure of development corresponding to the length of use.
That's a vicious cycle.
There's a vicious cycle. The more you use, the more brain damage you sustain.
Most people look to examples of, addiction seems to run in families.
It does.
Or even runs in communities.
It does.
Give your thesis an explanation of those kind of conclusions.
Well, we have a very tragic case control experiment here in Canada with our First Nations population. There were addictive substances in North America before the coming of the Caucasians. In some areas there was alcohol, there was peyote, there was tobacco, there was no addiction. If addiction was genetic, those people should have been addicted. What happens is, of course, if you traumatize people, if you disempower them, if you take away their spiritual place in the universe, if you deprive them of meaning and dignity, if you take away their ways of making a living, if you destroy their communities and you keep this going for generations, then the need for soothing and relief becomes entrenched in those communities. And the trauma is passed on from one generation to the next, because parenting styles are inherited not genetically, but biologically and behaviorally and psychologically from one generation to the next. So that means that now we have a highly traumatized population. 50 to 60% of our jail population is Aboriginal Canadians, even though they only make up 2 or 3% of the population.
Same with your patient caseload.
Exactly. 30% of my clients in the downtown east side are Aboriginal Canadians. And it's not because of any genetic predisposition. It's because of what's happened to them. So that things can go on in a family and pass it on from one generation to the next because you create the same conditions. It's got nothing to do with genes.
Addiction is a result of trauma. So if your addiction is stress related or anxiety related, there is a wonderful method, very simple. You can do that at home. I'll put the link in the description. This is Liz Koch, and she works with the Psoas. And I have tried this exercise myself, and it's wonderfully relaxing.
Welcome everyone. I'm going to be working with a ball, and I use a soft, supple exercise ball, pretty deflated, and place it behind my heart. It's a very simple exploration. I begin by simply rocking.
So I consider this to be very important, especially when you have been a vegan and have become sick from this deficiency diet. It is not selfish if you choose health. If you choose to eat meat again, get away from deficiency, heal your body, it's not selfish. Because in the end, when you are healthy, you have more energy, you are happier, and then you can actually do more. When you are sick, then this doesn't help anybody. Not the animals, not the environment, and not yourself. So always choose health. So this is why I prefer a meat-based diet, because I have really witnessed what it can do and how my body benefits from it. And I never want to go back to food addiction and carb load if I can help it. I always will be preferring meat over any other food. This is so true. I need a lot of alone time and silence to recharge.